We will be presenting on the issue of immunization of children. We feel that immunization should be required. We will cover the costs, harm, and detriment, and finish with recommendations. The immunization of children against a multitude of infections has been acclaimed as one of the most important health interventions of the 20th century. Immunization is a way of forming immunity to certain diseases by using small quantities of killed or weakened microorganisms that cause the particular disease. Therefore, vaccinations are safe, effective, and protect others you care about. Vaccinations have reduced the number of infections from vaccine-preventable diseases by more than 90%. Vaccine-preventable diseases have not vanished yet, so vaccination is still essential. Yet many parents still question the safety of vaccinations and choose not to vaccinate their children. This is because of misinformation that was given. Parents' concern for vaccinating their children often stems from the safety of any given vaccination. Before vaccines are released to the general public, it goes through rigorous testing by the FDA, just the same way any other prescription drug would. Taken directly from the FDA website, at any stage of the clinical or animal studies, data raises significant concerns about either safety or effectiveness. FDA may request additional information or studies, or may halt ongoing clinical studies. The research and safety protocol does not end there. Throughout the duration of the vaccines used, the FDA, alongside medical professionals, continuously monitor for side effects that could not have been picked up on during the preliminary phases of the vaccine. Many parents fear the individual ingredients found in vaccines, such as aluminum and formaldehyde, without knowing that their children are exposed to these chemicals every day. In fact, according to studies conducted by WebMD, babies can ingest more aluminum through breast milk than a vaccination. The most common vaccination side effects in children include pain and tenderness at the injection site, fatigue, nausea, and mild rash, which is a small price to pay to prevent common illnesses that vaccines do prevent. The CDC estimates that children vaccinated between 1994 and 2014 have yielded net savings of $1.38 trillion in societal costs, including money saved by preventing lost productivity due to disability and early death. Additionally, according to International Vaccine Access Center, Johns Hopkins Bloomberg School of Public Health, $62.9 billion could have been saved by providing Hib pneumococcal and rotavirus vaccinations to the 73 poorest countries' children. Vaccines cost less than treating the infectious diseases they provide immunization to. For example, children under 5 with the flu are contagious for about 8 days, and according to a 2012 CDC study, cost their parents an average of 11 to 73 hours of wages, and that's about $202 to $1,456, and $300 to $4,000 in medical expenses when the flu vaccine is nearly free to the public through special social initiatives. Recently, there has been a trend to choose not to vaccinate children over a scare of vaccinations causing autism in young children. That scare has been disproven. Negative externalities form when people choose not to get vaccinations. Vaccinations are not given to the vulnerable population, which are infants and people who have an immune disorder. Because of this, it is very important that the herd community receives the vaccinations. According to Dr. Offit, Chief of Infectious Diseases at the Children's Hospital of Philadelphia, it is a social contract to protect the small minority of people who cannot receive vaccines. If enough people in the majority or the herd receive them, it will protect everyone. The most vulnerable population is babies and the elderly. An example of what could happen if people stop receiving vaccinations happened in 2008 in the UK. The MMR vaccine prevents mumps, measles, and rubella, which are all very harmful viruses. Many families decided not to have their children get the vaccinations, which not only made their children at risk, but also the already vulnerable populations. Because of this, the herd threshold fell to about 94%, causing an outbreak after about 14 years of not having one. Because of all these risks and harms, it is easy to see why vaccinations are so important. They are public good, meaning if someone else consumes them, it doesn't affect others' consumption. If everyone that could get vaccinations actually did, this would reduce the outbreaks of different diseases and prevent the negative externalities of outbreaks and deaths.